I had a chance to talk to Dr. Jira Thawornpradit, who's from BDMS Wellness Clinic, and it is one of the biggest medical conglomerates in Thailand, on what she thinks about the future of medical tourism. So Dr. Jira told us that medical tourism in Thailand has been widely recognized internationally, especially for the quality of medical services that are up to standard, as well as hospitality and the overall costs that are not too high compared to other countries. She also has hopes that the medical tourism in Thailand will revive, especially after the country's reopening. But another trend that we'll be able to see after the pandemic, apart from medical tourism, is wellness tourism. Not only because people are more aware of their health, but it is also related to the changes in demographics, as Thailand entered the aging society with more than 20% of the population who are above 60 years old, and the number of deaths from non-communicable diseases that are constantly increasing.
หลังจากเปิดประเทศในช่วงนี้เองเราน่าจะเห็นเทรนด์หรือทิศทางการดูแลสุขภาพในการท่องเที่ยวเชิงสร้างเสริมสุขภาพหรือที่เราเรียกว่า wellness tourism มากขึ้นนะคะคำว่า wellness tourism เนี่ยคือกลุ่มเป้าหมายหรือกลุ่มลูกค้าที่เข้ามาตรงนี้เองเนี่ยจะแตกต่างกับ medical tourism ที่ว่า medical tourism คือตั้งใจที่จะเข้ามารับการรักษานะคะไม่ว่าจะเป็นกลุ่มของ NCD กลุ่มโรคไม่ติดต่อเรื้อรังกลุ่มมะเร็งแต่ในกลุ่มของ wellness tourismเนี่ยคือเป็นกลุ่มที่มีสุขภาพดีแต่เขาเริ่มมองหาค่ะว่าการท่องเที่ยวแบบไหนที่เขาสามารถทำให้สุขภาพดีขึ้นด้วยในเรื่องของ wellness tourism ต้องใช้หลายภาคส่วนร่วมกันนะคะหลายภาคส่วนร่วมกันคือไม่ใช่แต่เพียงแต่ของทาง medical หรือทีมทางการแพทย์อย่างเดียว
Meanwhile, the director of the International Marketing Division of Yanhee Hospital firmly believes that there will be two significant changes for Thailand's medical tourism after COVID-19, especially after the country's reopening. One of these significant changes is the quality of patients that will be coming into Thailand in the near future.
There are two things that will change after the pandemic. In fact, it's starting right now because Thailand has opened already. The first change is the change in number of patients. It will change quantitatively. Of course, the change will be slow and gradual as people become more comfortable in embarking on trips going abroad, and as people, the fear and the apprehension will disappear from people's minds. This is a gradual change. The number of patients will increase. Yes, they will increase, definitely, most definitely. But there's a second change that is more interesting and in fact more profound than the first one. And this is on the quality of patients who will be coming here to Thailand. Perhaps the backpackers will not be able to come this time. As we probably know, airline tickets are very expensive nowadays. And in addition to that, there are requirements that would be expensive for tourists, for them to be able to come. I think the greater change, the more profound change will be in the quality. Perhaps only a few patients will be able to come. But these are the patients who pay huge amounts of money for the procedures that they would want to have in Thailand.